Menopause brings many changes to a woman's body: hot flashes, mood swings, and unfortunately, hair thinning. One of the most frustrating symptoms of menopause is seeing your hair lose volume, density, and shine. A lot of women believe that once it's gone, but the good news is that's not the case. In this video, we'll talk about why menopause causes hair loss and what's actually happening in your body, and what we at DSI Hair recommend to help women restore and maintain fuller, healthier hair as they age. I'm Dr. Lauren Boshnick, a board-certified dermatologist here who specializes in hair restoration. Located in the Chicagoland area, our team has helped thousands of women address hair loss of all different kinds, from early prevention to advanced restoration. Menopause triggers a major hormonal shift, particularly a drop in estrogen and progesterone, two hormones that help keep hair thick and in its growth phase. As these hormones decline, the relative influence of androgens, like testosterone and DHT, increases. DHT can shrink hair follicles in certain areas, causing female pattern hair loss, typically seen as diffuse thinning along the top, crown, and part line, rather than total baldness. You might notice a wider part down the middle, thinner ponytail volume, more scalp showing in bright light, more shedding in the shower or brush. These are all signs that the follicles are miniaturizing, but still active and can respond to treatment. Hormonal changes during menopause can also affect the thyroid gland, leading to imbalances that exacerbate hair loss. Blood tests can help diagnose thyroid issues as a contributing factor. For many women, hair is deeply tied to identity and confidence, so even mild thinning can be distressing. If you're a perimenopausal or menopausal woman who's dealing with hair loss, you should know that you're not alone, that this is very common, and that there are real, medically proven ways to restore fullness. DSI's approach to menopausal hair loss. At DSI, we take a multi-layered medical approach that starts with identifying the underlying cause and creating a tailored plan for the individual. Here's how we typically guide our patients through it. First, scalp evaluation and diagnosis. We start with microscopic scalp imaging to assess follicle density and miniaturization patterns. We may also order blood work to check hormone levels, thyroid function, and nutrient status, like iron, zinc, ferritin, and vitamin D. This step helps determine whether your hair loss is due to hormonal imbalance, nutritional deficiency, or another cause like stress-related shedding. Second, medical therapies. Topical or oral minoxidil. Minoxidil is a vasodilator, which means it widens blood vessels and improves blood flow to the follicles. This keeps more hair in the growth phase and helps regrow low density. We customize dosing and application methods based on your scalp's response and sensitivity. Finasteride or Spironolactone when appropriate. In some cases, especially when DHT is a key factor, and if you're experiencing significant shedding, you may need to be prescribed oral DHT blockers under medical supervision. These medications reduce the hormonal effect on follicles and prevent further thinning, though they're only prescribed when appropriate after full evaluation. Hormone replacement therapy can help balance hormone levels, reduce symptoms like hot flashes, weight gain, and hair loss by restoring estrogen and progesterone levels. HRT supports a healthier hair growth cycle and can slow down the progression of androgenic alopecia. Women considering HRT should consult their healthcare provider to weigh its risks and benefits. Low-level laser therapy. Red light energy has been shown to boost circulation, reduce inflammation, and enhance follicle activity. Nutritional supplementation, a balanced diet rich in vitamins and minerals, is essential for maintaining hair health. Supplements containing biotin, zinc, vitamin D, and fatty acids can strengthen hair strands and support hair regrowth. Incorporating foods like salmon, spinach, and nuts into your diet can also help. Menopause can be an emotionally and physically stressful time. And elevated stress hormones like cortisol can trigger telogen effluvium, a condition where more hair enters the shedding phase than normal. Prioritizing sleep, hydration, gentle scalp care, and regular exercise can help reduce tension. Even small lifestyle shifts can calm the nervous system, support hormone balance, and help prevent excessive shedding. Noticeable improvement usually takes 3 to 6 months, with continued density gains over 9 to 12 months. Ongoing care keeps your results stable as your hormones continue to change. Most success stories come from pairing treatment methods with a holistic approach. Our goal is not only to regrow hair, but to rebalance the scalp environment and support long-term follicle health. Menopausal hair loss is common, but it's not something you have to accept. By prioritizing your daily health, practicing good hair care, monitoring hormonal changes, and addressing underlying conditions, you can restore your hair's volume and your confidence. If you found this video helpful, please be sure to give a like and subscribe to our channel for more on hair loss, and leave us a comment below with any questions. We'll see you in the next one.